Good morning, everybody. It's Tuesday, October the 22nd, 2024. My name is Dr. Ronald Federici, board certified in clinical and neuropsychology, working with the most complex children with multisensory developmental issues, meaning brain issues, adoption trauma, alcohol exposure, drug exposure, severe behavioral problems. And what I've been seeing for 35 years is kids non-responsive to treatment, meaning that they've been on medications for the infamous ADHD, disruptive mood disorder, behavior problems, anxiety, depression, RAD, PTSD, and all these kind of things. So kids I see from across the country and even abroad, I've lectured all over the world, working with the most complicated kids, especially kids from traumatic backgrounds. I have 8 adopted kids from all over Eastern Bloc, 40 foster kids that were throwaways that people couldn't handle. Been doing clinical practice in a group, Care for Children International, for well over 30 years. We have some outstanding people that have worked in our domestic international team, and I've been the director for a long time as an expert in the most complex evaluation and treatment programs. So I want to talk again about kids that have been non-responsive to treatment, because I get literally hundreds of emails and calls a month from families all over saying, I need help with my kid. They don't know what to do with them anymore. They're non-responsive to treatment. On the YouTube channels here, I have a ton of videos about trauma, alcohol, drugs, pharmacology, therapy, education. And you look at my YouTube channels with my colleague Heather Forbes. We've done a 10-volume series. I've done a lot of shorts. I've done a lot of long clips. I've got a webinar that's free for people to look at, that's an hour long, that really covers a lot of areas. And just, I'm a straight up guy, right to the point, because so many people get involved with fluff therapy, fluff evaluators, who don't know what the heck they're doing and have never really experienced a child so out of control, where the parents go for an evaluation and they get a testing that's either, right now I'm seeing computer driven or artificial intelligence driven report that takes away from the human content, which is a real problem, because you got to do old school with these kids. You got to use your brain as a professional, as opposed to just judging the symptoms. Psychiatrists medicate every symptoms. Therapists try to talk to a kid who's not playing with the full deck or has had severe developmental issues, developmental trauma, working with the family with, sticker charts and nonsense things that don't work, or putting the kid in play therapy or non-productive talk therapies that the kid just doesn't process. Let me tell you about these kids. So maybe this will be a benefit to you all, because what I'm setting up here, I've been doing this a long time, and I want to share my information. So many families out there need a great deal of coaching. They need review of their records, review of the reports, dissemination of the reports, strong critique of the reports. More than that, they need a strong coach to tell them, okay, here's what's right, here's what's wrong, here's what you need to do, here's what's going to make it better on the 4-pronged approach. Let's fix the medical issues. Let's look at the educational issues. Let's look at what needs to be done in the family dynamics, and what do we do with the kid. If you got to have those 4-pronged approaches in order to deal with the kid. Being a neuropsychologist and a brain guy, I understand that the brain drives the behavior. And what so many people who come to me and write me from all over the world saying my kid's doing this and this, behavior problems, ADHD, medications, failing in school, disruptive, violent, aggressive, all these issues. And my first question is, how's their brain? They say, what do you mean? I said, tell me about the evaluations, the neuropsych, the neurology, the genetics, the medical, the pediatrics, the labs, the heavy metal toxicity, all. And they look at me and shake their head. They say, what the hell are you talking about? No one ever told me to do that stuff. No one ever told me they were fetal alcohol or drug exposed. Well, biological kids can have that if they got parents that are messed up. Adopted kids coming from high-risk backgrounds. We're seeing it not just Russia, Romania, Eastern Europe, all these places, South America. We're seeing it out of China now, Korea, kids that had alcohol and drug exposed, Vietnamese kids who may have been. So it's universal. Alcohol and drug exposures cause huge problems, as well as no prenatal care, no postnatal care, malnutrition affecting mental development, abuse and neglect, which wipes out the hard drive of the emotional intelligence and alters brain biochemistry based on high levels of cortisol and stress, wiping out the neural pathways, otherwise known as kid doesn't get it, Emotional brain is gone. We scanned the brains with Dr. Harry Chigani, world famous guy, for PET scans of kids who have come from traumatic backgrounds, over 8,000 kids. What percentage of their emotional brain was wiped out due to whether it be toxin or neglect and abuse? Over 90%. And if the emotional brain, which is a whole other structure deep down in the brain, through your ears straight down, if the emotional brain, which controls anger, memory, mood regulation, thinking, reasoning, problem solving, if that's wiped out, this kid's going to be wiped out. We know alcohol causes kids to be low and slow. Drugs affect biochemistry, but let's be realistic. How many alcoholics are doing some drugs, smoking pot, cigarettes, and how many drug addicts are still cracking a beer or some other hard liquor? Everybody lies in that environment, especially domestically, when kids are adopted domestically. But internationally, we often have low ball or marginal information. But many of the records say, yeah, the parents drank and drug and why the rights were, discontinued. And parents are not told the importance of how this affects the child's development. It wipes out a lot of issues and it makes their behavioral control or discontrol more prominent. And then you add in developmental neglect, abuse, neglect, physical abuse, sex abuse, neglect, isolation, withdrawal, chaos, confusion through the foster care system. Kids' brains, a mush. It doesn't know how to interpathway and regulate and connect. And so many of these psychologist people, traditional psychologists and therapists, are talking to the kid to death, talking to the parents, and it doesn't register because IQ may be up here, but EQ, emotional intelligence, if it's missing in the hardcore functions of the brain, the child's not going to connect the two, and they're going to continue to act out in very volatile, aggressive, violent manners. So having done this for a long time and lived it professionally, personally, foster care, lectured all around the world, national expert, that's great. Okay, I'm a big shot in my field. But you know what? Practicality, we got to get the information out to families in dire, desperate need that I get hundreds of calls and everything. Unbelievable what I get every month, pretty much the same stuff. So my webinar, it's going to be, helping non-compliant children. The family intervention program book I wrote called Starting Over, the Family Intervention Program. We're going to develop a coaching, teaching, training program for parents, which includes making sure you get all the medical, educational, individual, and family stuff in order, number one. Number two, review your records. And let's be open and critique what was right, what's wrong, what makes sense, and what doesn't. Number three, let's get you on a better pathway and cover the bases that have not been done correctly. Number four, let's be cautious on medication. I got my boards in psychopharm. I'm pretty good critique about this stuff. But medications can often make things a lot more complex and more difficult because side effects, appetite suppression, irritability, sleep problems. Often you get a sedated kid, but it's, the kid's still angry and irritable. Sometimes it helps. I'm kind of tired, I'll be honest with you. All my patients are diagnosed ADHD. Everyone that walks in my office, literally, give or take one or two, but we're talking, I've seen over 8,000 patients in my career. 7,995 are diagnosed ADHD, and there's so much more. It's a set of symptoms. I could line up 17 things. We're going to need to talk about, is your kid an atypical neurological autistic spectrum disorder case? Studies are showing, no one reads, that well over 83% of kids who are alcohol and drug exposed develop an atypical autistic spectrum disorder, which involves mood dysregulation, odd and unusual language, behavioral problems. Other issues are people miss the higher cognitive factors. Language processing, meaning they don't get an input of language, verbal reasoning, abstractive skills, short-term auditory memory, and expressive pragmatics, meaning they garbage in, garbage out. They don't understand what the hell you're talking about. And then people take them to therapy, or they yell at the kids, or they go to school. Kids lost. Other one is visual perception and visual organization. Not wearing glasses, how the child perceives facial expressions, body language, nuances of their environment, scanning, tracking. Processing deficits, executive functioning, the front part of the brain, which organizes, plans, organizes, and inhibits. And also, too, just the arousal centers of the brain. Motor, sensory integration issues, regulation problems, defensiveness, based on both brain, neuropsychological, and abuse. And chaos that go on forever and ever alter the brain. You have to develop a neurocognitive, neurorehabilitation, and a developmental reconstructive program for these kids, which sounds big words. I make it simple, uncomplicated, where it's step by step by step. Adults only, training, teaching, rehearsal, teaching language, logic, learning, and listening. Then we teach social behaviors. Then we teach social language. Then we teach social regulation. We use handle with care training for violence and aggression management. We use only the family intervention, not isolative therapies. Keep medications to a simplicity. Use good neurology people. Get genetics. Use good pediatricians who will listen to us and all this. And it's not that hard because I get a good rapport with people because I know what I'm talking about and I get straight to the point and develop a good, comprehensive, evaluative treatment program as a good family coach. So let's consider the Starting Over program. Let's consider you looking at our webinar, the Impossible Child Solution, working with non-compliant and non-responsive children. That's going to be up and running, probably is right now that my people are doing it. It's a free webinar. All these are free YouTubes. We're going to be doing more and more and more. I've already done a few short ones. This is a longer one. But Dr. Ron Federici, I'm in Fairfax, Virginia. Dr. Federici, DrFederici at AOL.com. Office phone number that we do triage to help people, 703-830-6052 for records reviews, signing up for coaching programs, giving information. And believe me, I'm not the Rolls Royce figure that everybody pays, thousands and thousands. I'm here to help and try to do a combination of individual and group training and get it all out there. Already been swamped with people wanting to do, coaching and really get the stuff down. Just finished a case, reviewing records that were totally chaotic, sorting things out, what needs to be done medically, educationally, family-wise, and individual, get the kid out of the hospital. It works if you wind up doing the right pathway and stay the course for 3 months. We've got research, we've got data, everything we send to people so we know it's not just BS or another type of garbage therapy. No. We're a developmental approach. I wrote all the stuff on it, tons of articles, tons of research. Give it away. I give it away. In my last book, I give it away as a guideline when we start the coaching program. And you know what? Much more economical, straight away, helps a lot of people, doing some individual and group. Some people need evaluative stuff that can be discussed. But, let's try to get together and do this correctly. There's so many kids out there that are lost. Parents give up. Parents are lost, overwhelmed. Develop a good organizational program by somebody who's lived it and walked the walk, as opposed to people who don't have kids, never had complex kids, or don't understand complex kids, but have spent $5,000 for an evaluation that says ADHD, RAD, PTSD, mood disorder, and conduct disorder, the big five, I call it. Beneath that, guaranteed, there's a neurodevelopmental hard drive problem that we can work on. Maybe never fix. My first book, I wrote about the 80% rule. If you get to 80%, you've done well. So, again, Dr. Ron Federici, Clifton, Virginia. I'm the president, director of Care for Children International, which is our group. We've got great behavioral people, autism people, and, we're working on getting the word out for this coaching review, treatment planning, family intervention program that's going to be very helpful. It is very helpful. And anybody who doubts it, fine. Look on the internet and scan around. Good, there's a million people out there who are selling something. Everybody's online doing talk therapy. It doesn't cut it for these kids. You need somebody straight away, all organized, well-planned, and who's walked the walk and has some real solid information about these kids. So again, Dr. Ron Federici, DrFederici at AOL.com. My website is drfederici.com, DrFederici.com. Phone number in the office, 703-830-6052. My manager, Angie's triaging people left and right who want to really get to the point and get this started and corrected and on a better path within 3 months. Because, not touting success, but it's very helpful. Because you know what? Doesn't play games. No nonsense, straight away. Teach, train, rehearse, practice, all family driven. And really cut to the mustard and review your other stuff and use it or redo it. Because people follow sometimes the wrong pathway as opposed to understand brain drives the behavior. So I'm happy to help. And I look forward to doing more YouTube and training videos, and the Impossible Non-Compliant Child Solution webinar, which is an hour, has all this stuff, and very detailed, will be very helpful too. And it's going to be up and running on YouTube anytime now, and along with this one. So thank you again, Dr. Federici at AOL.com. Hang in there and let me know.